Welcome to the RSM Talk Big podcast, helping you invest well, understand money, and achieve the best tax outcomes. Your hosts today are Andrew Sykes, Chris Oates, and Young Han.
Hey everybody, and welcome to the RSM Talk Big podcast, where we talk about how to create, protect, and generate wealth with you. My name's Andrew, and I'm joined today by Young.
Hi everyone.
And Chris.
G'day everyone.
Today we are talking health and health policy, and we're joined in that with by Sarina Lacey from the Centre for International Economics. Welcome, Sarina.
Thank you for the invitation, Andrew.
Oh, thanks for joining us. Hey, give us a bit of your background. Tell us a bit about yourself.
Well, I lead the health business here at the Centre for International Economics. We're a boutique economic consulting firm that works mainly in Australia, but also globally. And we've been doing so for, over 35 years, and myself for over 20. So been around a while.
And learnt a bit in that time. And you chose to go into healthcare.
Yeah, so I think health economics is a really, really important sort of place to be in a consulting space, but also, to try and achieve good population outcomes. There are a lot of complex issues in healthcare, how to get the funding amount right, how to fund the right services, how to get cost-effective outcomes so that money goes further. I mean, it really is an extraordinarily interesting career, yeah, I really enjoy it.
So, Sarina, of all the areas that you could choose in economics, why did you choose healthcare?
I'm just really interested in improving the health system. And as an economist dealing with, solving kind of complex economic issues, for me, there's no more an obvious place to be for that than trying to improve population health and, getting that balance between having the right amount of resources directed to the right patients at the right time to get, to achieve what you're looking for and to get really cost-effective outcomes and make sure that, the taxpayer dollar is extremely well spent to improve the livelihood of the entire population. So it's a complex area, but it's extraordinarily interesting. Yeah.
So if you get it right, if government gets healthcare right, based on obviously the advice of people like economists, it can have such a big impact on the lives of everyone, can't it?
Well, absolutely. But I mean, it's not just government. It's, the choices that we all make on a daily basis, and governments can only, incentivize us to behave in certain ways. And penalise us to behave in certain ways. It's really the responsibility of us all. But it's the health sector is expensive in Australia, and because of the kind of health system that we expect and that we have, we need to make sure that that investment is wise.
Yeah, and it is one of the biggest areas of government budget. How's it actually funded in Australia? How do we fund our healthcare system?
So Australia has a really, really a terrific and unique health funding model, and there really isn't another one like it. So we have, I guess, what is commonly called a sort of a mixed funding model. So we've got, a partnership really between government and private health insurers, along with consumers, to fund a health system that offers universal access to healthcare. So typically in Australia, if you're unwell, you're sick, you're injured, you can get the care that you need. So notwithstanding the holes that all health systems have, we really do have a compulsory universal health system. And that's really expensive, and no government in the world can fund that on their own. The partnership between government and private health insurers is essential to the Australian funding model. So essentially you've got government spread over two levels. You've got the Commonwealth government funding primary care and aged care and mental health in the main. You've got them giving money to the states to fund hospitals, public hospitals, that is. The private health insurers will pick up private hospitals, which are different to public hospitals and a very important complement to public hospitals, and also taking care of allied health services, which are terribly important to population health, not just surgically, but also around prevention and early intervention. And then you have consumers funding, out-of-pocket costs that sort of fall through all of those cracks. But it is this partnership between private health insurers and publicly funded health services that sustains the system.
So it is a balance. So everyone has to play their part. How does that compare to some of our some other countries? How do we compare?
Well, it's different in just about every way. So generally speaking, in countries that have that are supported under a private health funding model, it's not compulsory, it's not universal access, and that component funds most of healthcare, whereas in Australia it's just a proportion of that. And then you might have other countries that necessarily don't have a big focus on private health insurance and have state-funded health services only that are typically extraordinarily budget constrained. So our health system is very, very different, and it's very much shaped. It was sort of shaped sort of in that sort of late 80s and 90s, really sort of starting with Medicare and then launching into a whole range of incentives to shore up private health insurance so that you could take the burden and then try and basically keep people healthy as well as keep people out of public hospitals.
Yeah, I can remember life pre-Medicare, and it was an enormous initiative when it came in, wasn't it?
It was, and still, the pillar of the Australian healthcare system, but needs supports around it to make it financially sustainable.
It's great. We do actually hear a lot in the general press that it's negative about our healthcare system. So it is nice to hear someone say we're doing well.
And I think you mentioned about the role of private health insurance in the system. So we often get encouraged to get the private health insurance. Do you think it's worth it?
Well, it depends what perspective you're responding to that from, either as an individual or as a society. From a society's perspective, absolutely 100% it is worth it, because if we didn't have private health insurance, if we didn't have a healthy private health insurance system, we would not have the quality of healthcare that we have. We just simply couldn't afford it. So, that's really the reason why so much effort and subsidy goes into shoring up that coverage rate. So from a society's perspective, absolutely. But from a personal perspective, it very much depends. If you're very young and you're very fit and you're very healthy, you will face every stick in the world from government to make you take up private health insurance, because without it, it's probably not worth it.
But also some countries actually encourage people to actually save up rather than getting a private health insurance. So would this kind of system work in Australia?
Yes, I guess just to give you a little bit of context about what that is about. So that's medical savings accounts, which is, I guess, a sort of a little bit of an in-between sort of health funding model that a lot of countries use. It's not really private health insurance, but it's a bit close to it. So it's really matching people's effective private health insurance coverage with their level of savings. So that's generally how it's done overseas. But there has been debate in Australia over the years around having medical savings accounts here, particularly around those areas where private health insurance isn't terribly good value for money. So, despite the fact that all of the marketing around private health insurance is often around the extras, it's, that's not actually where you get your biggest value, because, it's pretty difficult to go to claim on your extras and not find yourself with, a relatively large gap to still have to pay. So the value proposition isn't really that strong there. So the concept is, well, why don't we as Australians save and have a special savings account that when we need to go to the physio, or we need to, we want to take those, the sorts of things that we might use some of those extras sort of covered items for, and pay for it out of our savings. Well, there's nothing stopping us doing that. But the reality is we don't do that. We always find something else to spend that extra $50 a week on. So the concept is around what could government do to help us save? And it's a little bit like a superannuation sort of incentive, that if we saved for our own health, in a special account that was used for our healthcare, for our out-of-pocket costs when we needed it, could we get some kind of tax advantage for doing that? Or potentially forgiveness from some of the sticks that try to make us take up private health insurance.
Or even just employer putting some money into this savings account like they do for Super Guarantee.
They do, but that's still government stipulated. So, and there are special sort of tax arrangements around that. So it's still, an incentivized product. So yeah, it is a really, really interesting concept. And it'd be terrific to see more, as many good mechanisms in place as there possibly could be to give people options for saving for and funding their own healthcare. The challenge is, well, where does the money come to subsidise it? And what does it mean for the other subsidies that are already in place around private health insurance? So it's quite complex because, again, the whole Australian health funding model is predicated on having a really vibrant, sustainable private health insurance sector so that we have good private hospitals to alleviate the burden on our good public hospitals.
Yeah, it's interesting because I've had it said to me, particularly after someone's gone to the dentist and they realise how little they get back from their private health insurance for something like a crown. And the conversation normally goes, oh, I shouldn't have been in health insurance for the last 20 years. I should have saved that money every year. I just don't think the average person not many people will actually do that. I think you made the point that the money always gets spent somewhere else, build up this nice pot of it, and you don't want it to go on the healthcare.
Yeah, and I guess it's also when you think about the way that we subsidise our private health insurance sector, their subsidies are either about increasing uptake or they're about sharing costs. So as an individual, you can't share your costs with anyone else other than yourself. So you're either never sick or you're sick sometimes or you're always sick and you've got no one to share that with. Whereas the incentives around private health insurance require a lot of that risk pooling so that can be a viable system. So yeah, if you're going to take the individual approach, it really is to roll the dice.
Yeah, it's interesting, Andrew, your comment about insurance premiums. I know life insurance companies, for people that are healthy, they might get a benefit by reduced premiums, but if you're unhealthy, you might have to pay a bit more. Do you see whether there's a need for health reform to reward good health and maybe penalise unhealthy habits?
Well, yes, is the short answer. And that's not sort of a new development. It's just something that's actually quite difficult to achieve. So, we do have systems in place that currently penalise unhealthy habits. The most obvious example is the enormous tax rates applied to cigarettes in particular, but also alcohol. We also have rewards for, doing the right thing. So, I guess couple of examples that come to mind. You've got, some diets like the CSI or Total Wellbeing diet, will return your course fees to you if you complete the program and comply with what it tells you to do. And you've got some of the private health insurers will offer, incentives for free gym shoes and things like that because they know if their membership goes to the gym, they're going to be healthier as a rule and kind of manage their health. So there are sort of little pockets of it. Of that, and that's certainly something that's important to capitalise on, do more of, always seek to improve on, absolutely going forward. The challenge, though, is that we have kind of essentially a no-fault health system. So, there's only so much that you can control. When you think of the leading cause of death for men in Australia is coronary heart disease, and it's dementia for women, closely followed by coronary heart disease. These sorts of things can be difficult to self-select out of. And obviously cancer is a big driver of deaths in Australia as well. So yes, we do need a system that does more to reward being healthy and penalise being unhealthy. But we also, because we're committed to universal healthcare, we need to make sure that we're funding things on a no-fault basis.
We could also stop middle-aged men riding mountain bikes and having accidents. would make the health system cheaper as well. But so what you're saying overall is if we had a healthier population, so if we focused on health, it wouldn't cost as much. Would that be fair to say?
Well, it would, although I must say one of the things driving up the cost of healthcare is us getting healthier and more wealthy and have higher expectations of what we want from health. But yes, absolutely, prevention and early intervention are pillars of improving population health. And are a real area for future policy focus. The challenge with getting them over the policy line at times is it's quite difficult to do. I guess what we would do is, traditional cost benefit analysis around prevention programs, because it's a bit difficult to pinpoint the counterfactual and measure the difference between doing something preventative and not doing something preventative. So it's often very challenging to get preventative healthcare policies over the line and widespread and well-funded. But yes, absolutely, that is something that is a core priority of government and for all Australians.
So in that note, what is government doing now to reform the health system? And is this a move in the right direction?
Well, there's lots of things going on at once, as I suppose there always is in healthcare. But I think, well, I guess it's because it's what I'm closest to, but I really do think there's been a very long period of very sustained reform in health for some time now, and absolutely in the right direction. So I guess there's kind of a gradual shift away from what I would sort of colloquially describe as the pincushion approach, where you sort of have a sick person and you do absolutely everything you possibly can to them and see what works, which is enormously expensive and not very nice for the patient, and moving to much more focus on being more patient-centric. And what does this patient actually want from their healthcare? What is a good outcome for them? I mean, is it that extra 10 years of life, or is it a good quality 5 years? Or, being and thinking about how do you integrate services a little bit more and try not to kind of deliver them in the silos of different medical professions. And so say, well, when we kind of put together this jigsaw of health specialists, how do we improve care? So there's a really good trend towards being more patient-centric, a really positive trend towards multidisciplinary models of care, where you're getting, not just specialists, but also, healthcare workers to work together to get, the expertise, the right expertise when it's needed, but where you can sort of optimize that skills mix and get, you don't necessarily need the most expensive unit of labour in the room at all times, and just sort of trying to find ways to package care together so that you achieve both better outcomes for patients and improve the cost effectiveness of care.
I absolutely agree with that. I actually work with a lot of doctors, and one thing that just opened up my eyes was about the MBS. So how little education and support the doctors get when they're going through that years of study, and all of a sudden they've got a fellowship and they're supposed to know everything. But when you're looking at MBS, it's actually designed to provide those high quality care and preventive health care. And GP is also GP specialists. So if we can actually provide more support for the GPs, I think the overall health system can get better, because people in that area actually servicing the patient can provide a better system and better support. But if we don't have the right policy and support from the government and then the system itself, they're just under the pressure.
Yeah, no, absolutely. So, I mean, getting really, I guess that's pull part of the jigsaw puzzle of health funding. So you've got to get all the pieces working well to get the best outcome. And primary care is absolutely critical in that regard, particularly when you think about the most expensive thing to happen to a person is to have them end up in hospital. So the more we can do to manage severity and improve self-management of patients and avoid those sort of high cost interventions, absolutely the better. And there's certainly been, I guess, a long process of MBS reform over the last few years, which has been trying to really kind of update the MBS to reflect good quality evidence around interventions that work, and potentially take things off the MBS that aren't necessarily achieving that, which is always, I guess, a very, very difficult process. But I guess one thing that I would say around things that are happening in healthcare reform is it's actually pretty difficult, or not just healthcare, but all reform at the moment because of COVID.